Okay, how to get healthy, how to be healthy, and how to navigate the healthcare system so you can have your optimum health and have the best shot at being healthy. There's a couple of things that you absolutely need to know. And without these things, it'll be pretty hard not only to be healthy, but to stay healthy because some people call them traps. I don't know if that's the right word, but there are a lot of companies. I mean, we live in a for-profit healthcare system where every company, provider, plan, or hospital, they're there to make money. And they make money when you're sick and when you have disease, right? We all know that, but we don't live in that way. Meaning, if we know that to be true, the last place we ever want to be is in a doctor's office or hospital, especially when we are sick. But for some reason, today, we go to the doctor's office and the hospital, and not just when we're sick, and the most likely place to die, don't go to a hospital. We're actually being convinced that that is the only choice and the best option that we have when it is in fact our worst. I mean, the best way you distract somebody is to have them focus on everything else other than what's really important. And I'll tell you what's important is something that we all know, right? It's not hard to be healthy, but we all make choices. And it's like someone that doesn't ever do push-ups and pays somebody else to do push-ups and thinks that it's going to make them healthier, stronger, better. You just can't do that. And in the same way, it doesn't matter how much money you give a doctor or a hospital, they can't make you healthier. I mean, sure, we come up with some pretty cool advanced things and they can delete or help you manage some of the symptoms. And delete is a strong word. Most of them don't delete. Most drugs and most treatment just cover the symptoms. And we know that because if you go to a doctor's office, if you're going there for heart disease or breast cancer, I mean, at least 70% of the time we found it's not a heart disease or breast cancer issue. Cancer is the result of some other system breaking down, right? So when we know that 70% of all disease, actually 90% of all known disease in the body starts from the mouth, we should start there first, right? Where health starts. And if we get rid of that root cause and infection and disease in the mouth, it's surprising to see all of the other health issues just start to suddenly go away. I mean, there's some people that are prescribed, 3, 4, like just multiple medications, let's say. And after they get the surgery, they're able to reduce the amount of medication they're taking by usually about 70 to 80%. That's a huge deal. And then we just need to take this step by step. So the last place you want to be is a doctor's office or hospital, especially when you're sick, or especially if you're planning to be sick. There are some really good biologic doctors or holistic doctors out there, but there's been such a, how do you say it? It's been treated like a black sheep. So it's so hard to find a good holistic doctor. And again, most holistic doctors, if they don't understand the primary source of infection, 70 to 90% of the time is going to come from the mouth. Unless if they're also licensed as a dentist, they can only tell you what to do, but they're going to probably have to work in conjunction with a dentist. And this is what very few people know. So in order to navigate your health, the problem with going to a dentist is, and I love what cardiologist Thomas Levy says, and he's actually not even practicing anymore. He's a doctor and a lawyer, so he's got an MD and a JD, but he's written the book Hidden Epidemic, Toxic Tooth, Rapid Virus Recovery, and he's known as the vitamin C doctor. But what I love about Dr. Thomas Levy is he's not just promoting the use of, it's called allopathic medicine, by the way. And anybody that says the term quack, if you've heard that term before, to discredit doctors, it was actually designed by the Rockefeller and the pharmaceutical and the people that are using these chemical drugs that are based off of petroleum products and essentially industrial waste and byproducts that we weren't able to use. And they were designed for machines or, industry. They were never meant for the body. But it was cheap to do so because they had so much of a surplus of it. But the only way that they can get these products to market and get these services to market and grow these large hospitals is they had to go around and burn all of the books and discredit all of the doctors and call them all quacks. Now, it's funny because they called them quacks to discredit it, and they cleverly came up with, like a brainwashing method through the words that they were using. There actually is a scientific method, and it's called like NLP, and then more advanced methods that get into how to brainwash, how to set societal, how do you call them? Disconnects. Just things that don't make sense of the society. Some of these things were unintentional, but some of these things were very intentional to make profit. And one of those things is separating or segregating dental from medical. There was no reason to segregate dental from medical. And even if you segregated the insurances, medical insurance was always designed to be the primary, and then dentist or dental insurance was designed to be the secondary. But right now, the problem is when you go into any dental office, they only ask you for your dental insurance or the cash out of your pocket. And if you try to use your medical insurance, they say, oh, I'm just a dental practice. So I'm here to tell you that, well, first of all, avoid any dental practice that isn't willing to take your dental insurance. And most of them aren't, by the way, 99% aren't. So I'm not saying just go look for the one, but here's some other questions to ask to even know if you're in the right dental practice or not. Because like Thomas Levy says, the worst thing you can do for your health is see and submit to a conventional dentist. The best thing that you can do for your health is go to a ozone using biologic dentist. And the reason why is because you don't want to have something in your mouth that can cause permanent toxication, infection, and promote, just disease, right? You don't want that. And if you go to a traditional dentist, like you go to a traditional doctor, it's going to be the same thing. Like doctors know that if you come in to see them and they're overweight, they know what to do to tell you. They know to tell you to exercise. They know to tell you to sleep well. They know to tell you to make sure you hydrate and drink healthily. But everybody thinks like drink good water, eat healthy food, like avoid fast food, avoid sodas. They think that's just something that they say, but that's literally it. Of course, there's details to it, but if you just have those healthy things and you avoid the toxins, and we all work together to avoid the toxins, we would never be in that place in the first place. Or we would never be in that... Anyway, you know what I mean. What I'm trying to say is, whenever you see any provider, make sure you go to one that understands that your body is connected. And because in this current situation where most people are ignoring their mouth, and we kind of do it as a society, but not just because of that, even if we didn't have this current political structure and this insurance structure, still the mouth is where health starts. It's not something that was created. It was made worse by ignoring it or using that dirty 6-letter word that starts with D and ends with L, as a reason or an excuse to not cover or not focus on the most important part of our body and our health, which is our mouth. So when it comes to being healthy, it's very simple. The way you are healthy is, first of all, avoid going to a doctor, avoid going to a hospital. You don't need tests for anything there's no real solution for, right? Why get tested if you're just going to be given 14 chemicals that you don't want? Because some person on TV told you wanted these 14 chemicals? You know this in your heart of hearts. Any one of these chemicals injected into a person, if you as a mom or dad did it, and you injected your son or daughter or any family member with these, even one of these chemicals, you would go to jail. That person would die. But because it's a little bit of amount and mixed with 13 or 14 other chemicals, we all of a sudden think it's some life-saving miracle. Just doesn't make sense to me, right? And meanwhile, we have to understand that our body is filled with bacteria and viruses. Actually, the standard average body has about 300 billion human cells, but 380 billion virus cells. We have more bacteria and virus in our body than we do human cells. They say by weight, it is 1/3 of our weight. So it's not about deleting the virus, which gets into this next point. So how do you be healthy? I want to tell you, it's not about deleting the virus. It's not about deleting bacteria. Anybody that wears a mask over their face and doesn't realize that that mask is it's a surgical mask for a reason. You have to understand why it was designed. It's for people spitting or blood or any liquid spitting into your mouth or in any way you can inhale or breathe in. It does not stop things that are smaller than the holes in the mask. Right? It's like a strainer. But anyway, I know most people are not wearing masks now. And if you are wearing a mask for your own health reasons, you should, but you should be educated that you don't wear it for virus or bacterial protection. You do it for dust, dirt, and liquid protection. It's not about bacteria and viruses. Once the bacteria and virus lands on the outside, it's very simple when you breathe in and out and in and out. It's going to come right back through to the other side. The hilariousness of how many people wore masks all day and continue to wear that same diaper on their mouth. And the reason why I say this is because if you look at studies done in the past, when there was the old epidemic in the Spanish flu era, a lot of people died too. But when they did the autopsy, they found they weren't dying from the bacteria or the disease. They were just dying from an infection in the lungs. And when they looked to see why the infection was in the lungs, because if it was virus and bacteria, it would just spread all over, right? But why was it in the lungs? It's because they were also covering themselves with masks, and those fibers, when inhaled, would lodge inside the lungs, and the bacteria would then grow inside the lungs. Now, not to go too much off topic, but because by population about half of us are female, I'm not, but the ones that are, or I should say people that use, personal hygiene products, tampons, it's the same thing on the other side. I'm not going to go too much in depth to this one because I'm sure there's some expert that will, but there are so many health issues that start because we're cramming something up inside, and by the way, tampons were designed for bullet wounds and holes. So like you plugged it, it was designed as a plug. That's what it was designed for. So, but when we use this on a, monthly and regular basis, and you have loose cotton fibers that when pulled out are left in the body, it's no wonder we have such a high rate of infection, and not just UTI, like other infections in that area. And okay, I digress. But point is we have to look at the simple stuff. It's not the things that we know or we have science about that kill us. Actually, science is probably why we're in the crap that we're in, excuse my language, but we just are doing everything backwards because we believe a paper or the company with the most money told us so, even though it's in complete, conflict of interest of what we know ourselves, right? So don't believe doctors, and definitely don't believe dentists that think, a neurotoxin like fluoride is okay in any amount. I mean, they'll give you studies, trust me. But also keep in mind, they're making money off of that. I haven't met one single person that doesn't make money off of fluoride or mercury that is going to try to convince you that fluoride and mercury is safe for you. At least drug dealers, when they deal drugs to you, they'll admit they're drugs and they're harmful for you if abused. But it's kind of dangerous when you have a doctor that will not admit and will actually defend the use of their harmful and in many times can be fatal in a high enough dose. But because they're licensed professionals, we trust them to put poison in our bodies. I don't know. I mean, I get it. Trust me, I understand because I was going to school to be a doctor. But I left because I knew in my heart of hearts, I couldn't say this simply, but I'll say it now. I wanted to practice health and not medicine. And there is a difference. Most of the doctors we see today are just glorified drug dealers that wear a coat and have a license, and they're protected by very, very, very large companies. And the only difference is instead of a cartel, they're called a pharmaceutical company. I don't see how that makes it any better. And if you actually look into it, none of these drugs are actually working better than the holistic alternative, because we deleted. We actually had to get rid of 170 different ways that were healthier, worked better, or had less side effects than the things that we're using now. The reason why this is even big is because they discredited all of them and used the money from all of the profit, because they were literally taking stuff that was garbage, worth nothing, and then selling it for a huge markup. Not even 10 or 100 times, sometimes thousands, sometimes hundreds of thousands of times markup. It was an absolute racket, and they're still getting away with it today. Like, that's why they can sell a drug for here in the United States for $8,000, but then when they send it to Africa, it's only like 30 cents, right? I want that 30-cent price here, and then maybe then it would be a little bit more fair, and people can make a decision instead of having to trade their savings and their earnings away for a treatment that doesn't even help them. All right, so I'm going to finish this up by saying, if you want to be healthy, it really is that simple. I'm going to make another full video on what to do to be healthy, but don't let a dentist tell you that mercury or fluoride is safe. Don't even visit a doctor. Skip the doctor or the hospital, because you can't pay anybody to be healthy for you. You have to do these things yourself. So how do you do it? It goes back to drinking good water. Most water is bad. Water treatment facilities were designed over 50 to 100 years ago. And even a lot of bottled water brands are known to be bad. I'll make another video on it, but if you go to EWG.com, you can actually see a database where they're testing tap water, and they'll show you just how many bacteria, perchlorates, and radiation and things are leaching into the water that you shouldn't be drinking. And a filter isn't enough. A lot of the bottled water companies and alkaline water, goodness, that's a scam. I just don't have enough time in this video. But if you're drinking alkaline water, make sure you watch out for that other video, because I'll go a lot more in depth and actually explain and break down exactly why in evidence. I'm going to show you pictures, blood tests. Yeah, not science. Evidence, proof, okay? Science is when you look through a little keyhole and only focus on one thing, and when you see it move, you get excited. But you're not looking at the whole picture. I don't believe science, because science is such an exercise in mental masturbation instead of actual evidence, actual proof. So if we're going to be healthy, eat healthy food, avoid processed food, avoid GMOs. Horrible. There's countries that have banned GMOs outright because of how bad they are. And fast food, high sugar, anything that's refined that your body isn't used to eating. And look at food allergies. And I would say detoxify, make sure you remove yourself of any other toxins in your environment. Make sure you sleep well. So eat well, drink or hydrate well, and sleep well. And don't overwork yourself. You need rest. You need time to play. You need time to discover your passions and enjoy life. And having solid relationships and having a very healthy love life, having very healthy communications is a scientifically, or I shouldn't use that word, it's a bad word now, but there's evidence and there's proof. If you look at the longest living civilizations, people that live the healthiest, like cultures from Sardinia or Japan or Korea, if you look at the longest living cultures, they not only eat well, they have very healthy communication and family relationships. So hating your family is an excuse, figure it out. Watch videos, work on it, because it does take a village to raise a child. And no matter what, your family is your family. So I'm going to sign off by saying health starts from the mouth, and so does disease. And dental is medical, and dentists are doctors, but make sure you choose the right one, because we do live in a for-profit healthcare system. So don't just believe any dentist doctor, especially one that's trying to promote chemicals to you. There's some chemicals in all processes, but in dental, and that's why we want to avoid going to a dentist at all. But if we need to go to a dentist, go to one that uses healthier chemicals and that understands your mouth is connected to your body. All right, so if you like this video and if you'd like to see more videos like this, be sure to like the video or save it if you feel like sharing it with anybody that you feel would benefit off of information like this. And I'm just starting to make these YouTubes. I'd love any feedback. Any and all feedback is welcome on how I can make these videos better, or what other information and content that you would like to see specific to living your healthiest life and your best life. Life isn't about work. Life isn't about struggle or disease, how many people are living it today. We really should be living a vibrant life with optimum health, and where we have confidence to go outside to live, play, and love. Thank you. I'm going to sign off on this video, and I'll see you on the next one.